السلام عليكم طلبة المرحلة الخامسة. The subject of our lecture today is about the facial pain. Pain is very important symptoms for us as dentists because it's considered as the main symptom of most dental disease. And we can define the facial pain as an unpleasant sensation and a subjective symptom which is difficult to investigate since it cannot be seen, smelled, heard, palpated, or tested, unlike lump or ulcer, which can be examined and assessed. But in case of pain, we depend mainly on the description given by the patient. And also pain serves as a good purpose, as it is act as a threat signal of an abnormality in the body that tell us that there is something wrong in this area. The nature and the characteristics of pain in each dental disease different from disease to other. For example, the nature and characteristic of pain in acute pulpitis completely different than that of a chronic pulpitis, on that pain originate from sinusitis or from neurology. So, to reach to accurate diagnosis for the pain and subsequent performing perfect treatment, we need to ask the patient list of questions that able us to make that correct, perfect diagnosis. From these questions, first, the type of pain. Is it sharp, tender, or it is dull pain? Its nature, like throbbing pain, stabbing, burning, or as electric shock. Second, about the severity. Pain divided into mild, which is that pain that managed with mild analgesia, such as aspirin, paracetamol, or moderate pain that is in response to the mild analgesia, or a severe that disturb sleep of the patient. The third point is the duration of pain, which is the time since onset, which is ask him, is the pain origin from days, weeks, months, year? And other important questions is the duration of attack. Is it just for last 4 seconds or minutes or for hour, and like this. Then ask the patient about the nature. Is the pain is continuous in attacks, or it is intermittent, or as paroxysmal? Then ask the patient about the initiating factor, as any potential factors. 6th point is exacerbation and relieving factors. What's make the pain be more severe or worse, and what's the factor that make the pain relief and subside? For example, as the hot or cold make it is worse, or ask him if it is an increase on eating, and all these cold, hot, and eating suggest that the origin of pain is from dental disease. Then we ask the patient about the localization. Can the patient tell us the exact point of the pain, or he cannot, as in case of acute pulpitis, he cannot determine what's the affective tooth in many cases, and in this case it will be poorly defined. There's an important thing asked about the referral. Try to determine whether the pain could be referred, because in many times a patient feel pain in the lower teeth, while the origin of the pain is from upper teeth. The main causes of pain that felt in the oral cavity is disease of teeth and supporting tissue, which is the periodontal tissue, all mucosal diseases, disease of the jaw, pain in the edentulous patient, post-operative pain mainly after treatment, pain triggered by mastication, referred pain, neurological disease, and psychogenic facial pain. Causes of pain from the teeth or supporting tissues. The most common one is the pulpitis, which divides to acute pulpitis and the chronic pulpitis. The definition of acute pulpitis is an extensive acute pulp inflammation, and it may be originating as acute pulpitis or it may be an exacerbation of a chronic pulpitis. The nature of pain in acute pulpitis is characterized by it is very severe pain, localized pain. The patient cannot determine the source of the pain because pulp has only pain fiber, and it does not contain proprioceptive fibers and mechanoreceptors, which is determine the site of the pain. The pain increases with heat changes, mainly cold application or cold stimuli, and sometimes it is tender to percussion. The tooth becomes tender to percussion. The patient feel an acute pulpitis is very ill, and he need urgent treatment because the pain cannot withstand by the patient. Chronic pulpitis, the pain not permanent feature and not severe like that in the acute pulpitis, but sometimes patient feels intermittent, dull, mild pain. Other condition that cause pain is dentine hypersensitivity, a cracked tooth or a cracked cusp syndrome. The tooth in this case will be sensitive to thermal changes on the cold and hot, but it is not severe. Periapical periodontitis, which also divide to acute periapical abscess and the chronic periapical abscess. In case of acute periapical abscess, the tooth is painful, extruded from the socket, and patient can localize the causative tooth because the problem affects periapical tissue, which contain mechanoreceptor, that it's a specialty of a special type of receptor that determine the site of the pain, which tell the brain the exact site of pain. The patient may have fever with regional lymphadenopathy. The tooth with acute periapical abscess is very tender to percussion, and also we can differentiate it from acute pulpitis in this, that the hot stimuli make the pain worse and increase pain of cold in case of hot application, while the patient may get relief with cold water or cold stimuli. Chronic periapical abscess, there is no pain or mild pain because there is a sinus discharge, so there is no pressure in the area. And the sinus or fistula considered as the main characteristic feature related and associated in case of chronic periapical abscess. Lateral periodontal abscess, the pain is due to gingivitis and periodontal abscess, and it's characterized in this case by it is constant in its nature. Acute necrotizing ulcerative gingivitis, the pain in this case is very severe and extreme, And the other symptom is presence of scattered pinch out ulceration and malodor, and maybe many cases there is gingival bleeding. Pericornitis. Pericornitis is the condition usually associated with partially erupted wisdom tooth. In this case, the pain is severe, and the other symptoms is a swelling of the cheek and limitation of mouth opening. The painful jaw disease divide into fracture, osteomyelitis, infected cyst, and malignant neoplasm. Moving to the causes of pain in edentulous patients, mainly the causes of that pain is due to the ill-fitting denture or artifact with denture, such as in case of denture trauma, that's maybe due to the sharp margin of denture, or due to excessive vertical dimension. Other causes that causing pain in the edentulous patient may be due to disease of denture-bearing mucosa, such as there's an ulcer lesion or lump, maybe due to disease of jaw, or maybe there's a teeth or tooth erupting under the denture. Other group of disease that causing pain is post-operative pain. That pain related to a complication after surgery or after dental treatment, such as alveolar osteitis, dry socket after traumatic extraction mainly, or due fracture of the jaw after an operation, or damage to the TMJ, or due to inflammation of the bone, the osteomyelitis, or maybe due to damage to the nerve trunk or involvement of the nerves in scar tissue after a healing of the lesion after operation. Other group of disease that causing pain, especially by mastication, the pain that induced by mastication is the disease of teeth and supporting tissue, myofascial pain dysfunction syndrome, disease of TM joint, temporal arthritis, trigeminal neuralgia, and salivary calculi. Referred pain is the pain that originating from an organ which is located at a distance anatomically far from the face and mouth, and referred to the head and neck, causing facial pain. We have types of referred pain, such as cardiogenic pain, which mostly referred to the angle of mandible at left side, and it resembles and simulate pain from third molar. So in some cases it is misdiagnosed between the pain from the lower 8 and cardiogenic pain. To differentiate between them, usually the referred pain from the cardiogenic pain is precipitated by exercise and stress, and usually it's associated with substernal pain, which is severe stabbing pain felt in the chest of the patient, and usually it's relieved by administration of nitroglycerin tablets. Neck pains, which may refer to the face when there's a neck lesion, and usually it is transferred to nerves C2 and C3 to the face. Lesions of esophagus and cardiac and of stomach, in some cases referred to the face and feel as facial pain, which can easily diagnose since that pain of stomach and esophagus occur usually after certain meals, and it causes mostly heartburn. Neurological disease. This disease will discuss in details in next lectures later on. Other is the psychogenic pain or atypical facial pain. This pain have a unique characteristic feature, which are: first, it's mainly affected women of the middle age or older. 2, absence of organic signs. There's no real disease in the teeth or in the oral cavity. 3, description of pain mainly bizarre and strange, and patient imagine the pain, so the description, it is not logic. Pain often poorly localized. Patient cannot determine the specific site for pain, and sometimes he said that the pain here, at other time he said no, it is here, so it cannot localize the pain. Delusional symptoms occasionally associated, so patient in the description for his pain, he related other imaginary symptoms with the pain, not really present. Lack of response to analgesic, so he when taking analgesia such as paracetamol, ibuprofen, the pain not relief, because it is not organic pain. Unchanging pain persisting for many years, and during the description of the patient, he said that the pain is from many years, and this pain does not disappear. Lack of any triggering factors, so and stimulating factor, and that's it. Normally pain from teeth are affected by the stimuli from cold or hot or mastication or other cause, while in the psychogenic pain there is no specific stimuli increase or reduce pain. And sometimes good response occur when patient taking antidepressant treatment. Moving to pain from extra-oral diseases, we have disease of maxillary antom or maxillary sinus, and the most important one is the acute sinusitis. This is very important for us as dentists, because it sometimes simulate and resemble dental pain, and in many cases is misdiagnosed as a toothache from upper posterior teeth, premolar and molar. And to differentiate between the pain from acute sinusitis and the pain from upper teeth, there is a certain characteristic features associated with the pain from sinusitis. Usually the pain from sinusitis is fluctuant with posture. That means when patient bend his body and make his head tilted downward, this will stimulate sinusitis pain, while the teeth not affected with posture of head. The pain from sinusitis not affected by hot and cold, while the pain from teeth usually stimulated with cold, such as an acute pulpitis, or with hot, such as an acute periapical abscess. Also, pain from sinusitis usually associated with uni or bilateral nasal block, mostly preceded by also by common cold. Usually patient before his infection in sinus, he have influenza, especially in winter. Other feature, when we palpate the sinus, the patient feel pain. Also, there's a supraorbital headache, and when we doing percussion for upper posterior teeth, the patient will feel tender in many teeth at the same time, while when there's a pain due to dental cause, just the specific tooth with the disease will affected by the percussion and feel tenderness. When we suspected that the pain is from the sinus due to acute sinusitis and not from teeth, we can send the patient to take an X-ray. When he take occipital-mental view, the sinus will appear as foggy in case of sinusitis. 2. Carcinoma, particularly when it involves the sinus or antrum flora, and the pain of carcinoma usually associated with epiphora, which is overflow of tears without patient crying. There's no crying and there's overflow of tears on his cheek. The other extra or disease that causing facial pain is the disease of ear, and we have a different condition of ear that causing facial pain, such as otitis media, mostly affecting children and young adults, and the pain of otitis media characterized by its acute, severe, and persistent. And when we examine the tympanic membrane, we found the tympanic membrane bulging and hyperemic. The other disease of ear is otitis externa. Usually the pain is moderate in this case, and usually it's associated with a boil. When we move the external ear, we can see a boil in the external ear. Neoplasm in the region of the ear also causing pain. Also, diseases of salivary glands causing facial pain, such as in acute parotitis, the inflammation of any of major salivary gland. 2. Salivary calculi, when there's a calculi in the duct of any of major salivary gland, that will cause pain. Also in Dragon syndrome, and when there's any type of malignant neoplasm involving major salivary glands. Disease of eyes also causing pain, such as iritis or conjunctivitis. TMJ disease causing pain, and there's many disease of TMJ causing that pain, and we will discuss this disease in details later on. Also, we have a group of disease involving organs anatomically located far from the head and causing facial pain, as in case of myocardial infarction and angina. The pain is referred through the cardiac nerve fibers of vagus, which communicate with the nucleus of trigeminal nerve in the brain, and also the neck lesions through the C2 and C3 nerve, and the lesions of esophagus and cardiac end of stomach also transmitted to the and referred to the head and face through the vagus nerve. Now we should know the common causes of paresthesia or anesthesia of the lower lip. Any condition cause interference of transmission of nerve impulse through the inferior dental nerve will cause paresthesia or anesthesia of the lip, such as in case of inferior dental block, the normal injection. When we treat the lower posterior teeth, and we will block the nerve transmission of nerve impulse to the teeth. Also, any lesion cause blocking for this nerve impulse transmission will cause paresthesia or anesthesia of the lip, such as in case of trauma, a fracture of mandible, that may be cut or cause injury to the inferior dental nerve, or in case as post-operative complication of any operation involving the area of the inferior dental nerve. Also, in case of acute osteomyelitis, malignant tumor of mandible, or in case of exposed mental foramen, when especially in the old age when there is absorption of the mandible. Other causes is herpes zoster infection, which is a viral infection, multiple sclerosis, and tetany disease. Myofascial pain dysfunction syndrome, which refers to the clinical condition characterized by pain, fatigue, and spasm of the muscles of mastication. Muscle of mastication, which are the middle and lateral pterygoid muscle, temporalis muscle, and masseter muscle. This condition is considered one of extracapsular disorders of TM joint. The main characteristic feature is the tenderness to palpation in one or more of these muscles, which consider the reliable diagnostic feature of myofascial pain dysfunction syndrome. Muscle tenderness is generally most prominent and pronounced near the origin or insertion of the affected muscle, but the belly is often at least mildly tender. This tenderness is most easily demonstrated for temporals and masseter muscle by applying fingertip pressure during extreme opening and closing movement of the mandible. The signs and symptoms of myofascial pain dysfunction syndrome includes spasm of one or more of the muscles of mastication, tenderness to palpation of one or more muscle of mastication, diffuse head pain that's similar to tension headache, and it's usually most severe in the morning, pain during jaw opening, limitation of opening measured to be less than 35 to 40 millimeter, which means less than 3 fingers of patient finger between the incisal edge at the midline of the mouth, lateral deviation during jaw opening, evidence of paroxysm or clenching, history or presence of generalized wear, fastes, malocclusion, or evidence of occlusal disharmony, unilateral or bilateral periauricular pain during palpation, when we put the index finger in the front of the tragus of the ear, the patient will feel pain. Joint sounds such as clicking, popping, and the crepitus during mouth opening. Myofascial pain dysfunction syndrome usually most commonly occur in young to middle-aged female who experience constant or episodic emotional stress. The symptoms of myofascial pain dysfunction syndrome tend to occur in cycles, with asymptomatic periods interposed between acute bouts associated with demanding emotional situations. Occlusal disharmony may be a contributory factor. Treatment of myofascial pain dysfunction syndrome involve: number 1, elimination of contributory factor if possible, if it is occlusal disharmony, if it's bad habit, or if it may be stress or psychogenic cause. So elimination of the possible cause is very important to relieve the situation. Number 2, palliative treatment during the acute episode or acute period of discomfort, including prescription of analgesic and application of moisture heat to the spastic muscle to relax these muscles, and this is generally adequate treatment in mild cases. Number 3, elimination of occlusal disharmony by removal of isolated interference and comprehensive orthodontic treatment for the complex malocclusion may be appropriated. 4, using of biplane. And 5, counseling and motivation of the patient to promote better adaptation of the patient to stress and dramatic emotional episodes may help in some individuals. And in many cases, combination of this approach may be necessary to achieve the relief in specific case. Eagle's syndrome, which is the ossification of stylohyoid ligament. This ligament that connects the hyoid bone in the neck with the stylohyoid process of temporal bone in the skull. It is a common idiopathic process which progresses gradually and is more pronounced and prominent among older patients. The ossification of this ligament usually revealed by panoramic X-ray of the patient, because normally this ligament is a soft tissue and does not appear in the X-ray, while after ossification it will become radio opaque and will be clear in the panoramic radiograph. The pain is caused by the resistance of the rigid ossified ligament to mobility of the surrounding soft tissue. This is usually associated with history of tonsillectomy operation, which has produced scarring in the area and entrapment of the ligament. Symptoms develop years after surgery as the ossification progressively increases the rigidity of the structure. The nature of pain associated with Eagle syndrome include sharpness in the throat during swallowing associated with a chronic sore throat without erythema. This sensation described as fishbone cut in the throat or as obstruction and burning sensation. Treatment for this condition is surgical removal. Fry's syndrome, as a result of this condition, appear as a result of TM joint surgery, injury, or infection in the parotid gland region that lead to damage to the auriculotemporal nerve, lead to connection between postganglionic parasympathetic nerve fiber from otic ganglia with which supply the salivary gland with sympathetic fibers from superior cervical ganglia which supplies sweat glands and the vascular wall at the auriculotemporal region. So, sweating and flushing to the region supplied by auriculotemporal nerve take place when the patient eats and the salivary gland stimulate. In this case, nerve connection is going to be wrong, so orders go from brain to vascular walls and sweat gland instead of going to the salivary glands. Treatment of this condition by rehabilitation and separation of the nerve fibers.